Did you know that over 2/3 of men over 60 face reduced penile blood flow, often mistaking it for inevitable aging? As a board-certified urologist with 30+ years of experience, I'm here to tell you it's not unavoidable. I'm Dr. James Carter, dedicated to helping men reclaim confidence, sexual health, and vitality after 60. Forget pills or surgery. 7 simple, science-backed habits can transform your circulation, performance, and intimacy. These strategies don't just enhance erections, they boost energy, confidence, and heart health. Your penis reflects your overall well-being. When blood flows freely there, it flows everywhere. In this video, I'll share 7 essential ways to care for your penis, improve blood flow, and reignite connection without drugs or embarrassment. Stay with me to learn how to feel alive and desired at any age. Before we get started, make sure to subscribe and tap the bell so you never miss another men's health tip designed especially for life after 60. If you find this helpful, type 1 in the comments. If not, type 0. Your feedback helps me make these videos better for you. Strategy 1. Prioritize daily aerobic exercise. If there's one thing I've seen time and time again in my practice, it's that movement is medicine, especially after 60. In fact, I've had patients who walked into my office with complaints of weak erections, low desire, and a loss of connection with their partners, and before we ever discussed medications or treatments, I asked them one simple question: how often do you move your body? Most of them hesitated. Not much anymore, they'd say. Some hadn't taken a brisk walk in years. But when I guided them to begin a regular routine of aerobic activity, even something as modest as a daily 30-minute walk, the change was often profound, not just physically, but emotionally and relationally. You see, aerobic exercise does more than get your heart rate up. It wakes up the entire circulatory system, including the network of tiny arteries that feed blood into your penis. These blood vessels are incredibly sensitive. When they're neglected due to aging, poor lifestyle, or inactivity, they stiffen, narrow, and restrict blood flow. That leads to softer erections, less sensation, and even emotional distance in intimate relationships. But when you reintroduce consistent movement, you breathe life back into your vascular system. Your blood pressure improves, your arteries regain flexibility, your endothelial function, the thin lining inside your blood vessels that regulates flow, begins to heal. This isn't just theory, it's physiology. Even more remarkable, aerobic exercise boosts the body's production of nitric oxide, the molecule that helps blood vessels expand. It's like nature's own version of Viagra, but safer, longer lasting, and without side effects. Solution for strategy 1. Start moving to boost blood flow and intimacy. Aim for 30 minutes of aerobic exercise like brisk walking, swimming, or dancing 5 days a week. A 68-year-old patient, Michael, began daily walks with his partner, noticing stronger erections and deeper connection. In weak studies show exercise improves penile blood flow by 15%. Try cycling or light jogging if walking feels repetitive. Pair with hydration, 16 ounces water daily to enhance circulation. If joint pain limits movement, consult a doctor for low-impact options. This habit restores vitality, making you feel energized and confident. Strategy 2. Embrace a heart, healthy, blood-flowing diet. One of the most overlooked truths I share with my patients is this: what you eat shows up in your blood vessels and your bedroom. When men over 60 come to me complaining about poor circulation, lack of sensitivity, or a fading sex drive, the first place I look isn't their hormones or medications. I look at their plate. Because the truth is, every bite you take is either fueling your blood flow or fighting against it. The standard American diet high in processed foods, sugars, fried items, and saturated fats clogs arteries, inflames tissue, and gradually suffocates the very blood vessels your erections depend on. The same narrowing that leads to heart attacks and strokes often shows up first in the smallest arteries, like those in the penis. But here's the good news. Food can also be one of the most powerful forms of medicine. I've watched men completely turn their intimacy around by making targeted, heart-smart changes to their daily eating habits. I'm talking about real, sustainable foods that repair endothelial cells, reduce inflammation, and increase nitric oxide, which helps blood vessels dilate and stay open during arousal. Solution for strategy 2. Fuel your body with circulation-boosting foods. Focus on leafy greens, spinach, kale, beets, and omega-3 rich fish, salmon, mackerel, to enhance nitric oxide by 10%, per research. A 71-year-old patient, David, switched to a diet of greens, berries, and walnuts, improving sensitivity in months. Replace processed snacks with avocado or olive oil-based meals. Aim for half your plate to be vegetables. If cholesterol is high, consult a dietitian. These choices unclog arteries, reignite desire, and strengthen intimacy. Strategy 3. Train the pelvic floor muscles. Yes, Kegels for men. If there's one area of male health that has been quietly overlooked and yet holds incredible power, it's the pelvic floor. Most men don't think about it until something goes wrong: trouble holding in urine, difficulty maintaining an erection, or a feeling of weakness during intimacy. But let me tell you, from over 3 decades of treating men over 60, strengthening your pelvic floor can be one of the most transformational things you do for your blood flow, your confidence, and your connection. I still remember when Tom, a 66-year-old retired school teacher, came to see me. He'd been struggling for months. Erections weren't as firm, sensation was reduced, and even when he felt aroused, he couldn't maintain things long enough to feel truly connected with his wife. He had tried a few supplements, even a prescription, but they offered only temporary help. What he needed was foundational strength, and it wasn't in a bottle, it was in his pelvic floor, the group of deep muscles that sit like a sling at the base of the pelvis, supporting the bladder, bowel, and, yes, the penis. Solution for strategy 3. Strengthen your pelvic floor with Kegels to enhance control and performance. Contract the muscles used to stop urine flow. Squeeze for 5 seconds, release 10 reps twice daily. Tom practiced this discreetly, regaining firmness and confidence in 6 weeks. Studies show Kegels improve erection strength by 20%. A 69-year-old patient, John, added pelvic yoga poses like bridge pose, boosting stamina. Practice anywhere sitting or standing. If urinary issues persist, see a urologist. This habit restores power, making intimacy feel vibrant and connected. Strategy 4. Sleep like your health depends on it, because it does. There's something deeply humbling about watching a strong man lose his spark. He doesn't talk about it openly, but it shows in the way he carries himself, in his silence, in how he avoids intimacy. I've seen this play out so many times in men over 60 who tell me they feel disconnected not just from their partner, but from themselves. And when we dig a little deeper, I often find something surprising behind the problem: poor sleep. Most people shrug off restless nights as a normal part of aging, but what many don't realize is that chronic sleep deprivation quietly destroys one of the most vital foundations of male vitality: testosterone and blood flow. You may not feel it after one bad night, but years of low-quality sleep compound in ways that profoundly affect your ability to perform, connect, and feel alive. Let me share a story. Frank, 69, came to me frustrated. His erections had weakened over the past year. He felt tired all the time, even though he wasn't doing much. Solution for strategy 4. Prioritize sleep to restore testosterone and circulation. Aim for 7-8 hours nightly with a consistent bedtime, dark room, and no screens 1 hour before bed. Research shows this boosts testosterone by 15%. Frank adopted a routine with no evening caffeine and a cool bedroom, regaining energy in weeks. A 67-year-old patient, Stephen, added 5-minute meditation to wind down, improving performance. If sleep apnea is suspected, consult a specialist. Quality sleep enhances clarity, desire, and intimacy, revitalizing your connection. Strategy 5. Reduce stress through breath, connection, and purpose. I've sat across from countless men who told me, "Doctor, I think something's broken." They'd explain how their bodies weren't responding the way they used to, how intimacy had become difficult or even non-existent. They'd mention the usual suspects: diet, low testosterone. But often, when I gently pressed a bit deeper, I'd find the true culprit wasn't physical. It was stress. Stress is quiet but relentless. It doesn't just weigh down your shoulder sit, constricts your blood vessels, tightens your chest, robs you of restful sleep, and slowly erodes your ability to feel desire, connection, and confidence. And over time, that chronic pressure begins to shut down healthy blood flow, especially to the areas most sensitive to circulation, like the penis. I remember one man, Alan, age 71, who had been married for over 4 decades. He came to me not because he was in pain, but because he was heartbroken. "We're not as close anymore," he said. "I just don't feel anything physically or emotionally." Solution for Strategy 5. Combat stress to unlock blood flow and intimacy. Practice daily deep breathing, 4-second inhale, 7-second hold, 8-second exhale for 5 minutes to lower cortisol by 15% per studies. Alan started morning meditation and walks with his wife, feeling connected in months. Try journaling or volunteering to find purpose. A 70-year-old patient, Richard, used yoga to reduce stress, enhancing arousal. If anxiety persists, seek a therapist. These habits relax vessels, boost nitric oxide, and restore emotional closeness. Strategy 6. Quit smoking, moderate alcohol. There are conversations that are easy for me as a doctor, and then there are the hard ones. This is one of the hard ones, but it's also one of the most important. When a man sits across from me, looking for answers about why his body isn't responding the way it used to, why his erections are weaker, why desire has faded, why intimacy feels like a memory, I always ask him 2 things. Do you smoke? And how much do you drink? Sometimes he'll hesitate. Sometimes he'll say, "I've cut back," or "It's just social." But more often than not, there's a quiet acknowledgement that these habits, formed long ago, have become part of daily life. And while they may seem small, the truth is, they are directly damaging the very blood vessels responsible for sexual function and connection. Let's start with smoking. Nicotine is a vascular constrictorate, tightens your blood vessels, damages the lining of your arteries, and reduces your body's ability to produce nitric oxide, the molecule responsible for relaxing blood flow into the penis. Solution for Strategy 6. Quit smoking and limit alcohol to protect blood vessels. Smoking reduces penile blood flow by 20% per studies, so seek support like nicotine patches or counseling. Henry, 65, quit after 40 years, regaining responsiveness in months. Moderate alcohol, 1 glass of red wine, daily supports circulation, but excess dulls nerves. A 68-year-old patient, Mark, cut back to 1 drink, improving desire. Consult a doctor for quitting plans. These changes restore vascular health, enhancing performance and connection. Strategy 7. Get a vascular health checkup. This last one might be the hardest step for many men, not because it's physically demanding, but because it requires courage. The courage to face the truth, to ask questions, and to finally stop ignoring the signals your body has been sending. But I can tell you without hesitation, getting a vascular health checkup could be the most powerful act of self-care you ever take. I've seen far too many men over 60 come into my office frustrated about their performance, convinced something is wrong down there, when in reality, the issue goes far deeper. Erectile dysfunction is often the first visible symptom of a much bigger concern, poor vascular health. And the truth is, those same narrowed or damaged arteries that are affecting your ability to get or maintain an erection might also be quietly increasing your risk for heart disease, stroke, or even diabetes. I'll never forget Paul, 72, who came to see me with concerns about a drop in libido and weak erections. He had written it off as just aging, but something in his voice told me he wasn't convinced. Solution for Strategy 7. Schedule a vascular checkup to uncover hidden issues. Tests like blood pressure, cholesterol, and glucose screenings detect risks. Early Paul's checkup revealed diabetes, treated to restore vitality. Doppler ultrasounds or testosterone tests can pinpoint penile blood flow issues. A 73-year-old patient, George, acted on results, improving erections in months. Don't let fear delay. you consult a doctor for a full panel. This step empowers you with knowledge, preventing serious health risks and reviving intimacy. Final thoughts. I want to leave you with something I've learned, not just from textbooks or medical journals, but from sitting across from real men for more than 3 decades. Men just like you men who have worked hard, loved deeply, sacrificed for their families, and are now trying to understand what it means to grow older with strength, dignity, and connection. I've heard their frustrations, their doubts, their quiet grief when their bodies began to change in ways they didn't expect. But I've also seen something else, something powerful. I've seen transformation. Because here's the truth, that most people won't say out loud, you are not done yet. Your body may be older, but it still listens. It still responds. And your desire for closeness, for vitality, for feeling alive in your own skin, it's still there. It hasn't gone away, it's just been waiting for you to turn toward it. Every strategy we've talked about is rooted in one simple idea. Your blood flow is the lifeline of your manhood. Take the first step today, your vitality awaits. Like this video, share it with someone who needs it, and comment 1 if it resonated, or 0 if not. Subscribe and hit the bell for more men's health tips. Next, I'll share a daily routine to boost intimacy after 60. Resources: exercise, walk 30 minutes daily for circulation. Diet, eat greens, salmon, and nuts for nitric oxide. Kegels, 10 reps twice daily for pelvic strength. Sleep, aim for 7-8 hours in a dark, cool room. Stress relief, try 5 min deep breathing daily.